The main question we were looking into is whether or not certification rates for home care aides has increased since the last audit. And Initiative 1163 basically increased the requirements for home care aides related to training and background checks. The second question we were looking at was whether or not DSHS and DOH addressed any barriers that they saw to certification for the applicants. And the last question we were looking to answer is whether or not those agencies have addressed the recommendations that we had during the last audit.
To determine if certification rates have improved, we use data from the Department of Health to calculate the number and percent of applicants who completed the home care aide certification process. We also interviewed staff from the Department of Health and DSHS to see if they've implemented our recommendations from the last audit.
The key discovery that we found out during this audit was that the completion rates have not changed since the last audit. They've been hovering around 56 to 58%. So those completion rates have remained flat. However, with the improvements that the departments have made, the overall number of certification has increased, so the supply has increased. Well, the demographics of the state are changing as baby boomers are entering retirement age and more of them are opting to receive care in their own homes. So it's vital that the state does everything it can to make sure that that need is met by certifying as many home care aides as possible.
We're recommending that the agencies continue to identify and address barriers to certification. We're also currently in the middle of another audit looking specifically at barriers to certification. We hope to have that published later this year.